It is extremely important to keep your asthma under control so that you can live a healthy, normal life. In order to do this, there are a few factors to keep in mind. You must receive the correct medication, you must take the medication as prescribed by your doctor, and you must use your asthma inhaler correctly in order to get the medication into your lungs. This video will demonstrate how to use your asthma pump with the best possible technique to get the medication to the deep part of your lungs. The most common asthma pump is the Press and Breathe Metered Dose Inhaler, MDIs. An MDI inhaler uses a small canister with a mixture of your medicine and a gas or liquid that turns the medicine into a very fine spray as you press on the canister. Most people call this a puff of medicine. The various parts of the MDI are the canister with the medication, the plastic actuator that the canister is in, and the cap that fits over the mouthpiece. Do not remove the canister from the actuator, as this can cause the canister to become blocked or the device to malfunction. To release a puff of medication, you remove the cap and press down on the canister. This is called actuating the device. Many MDIs have built-in dose counters, so you know how much medicine has been used and how much is left. How to use an MDI correctly. Single breath technique. Before using your inhaler for the first time, or if it has not been used for a week or more, test fire it by pressing down on the canister to release a puff into the air. Step 1. Remove the mouthpiece cover and check that the mouthpiece is clean. Shake the inhaler vigorously. Step 2. Hold the inhaler between your index finger and thumb. Breathe out fully through your mouth, pushing out as much air from your lungs as possible, and immediately place the mouthpiece of the inhaler into your mouth between your teeth with your lips tightly sealed and your tongue out of the way. Step 3. Tilt your head slightly backwards. Start breathing in slowly through your mouth. At the same time, press down on the canister to release one dose while continuing to breathe in slowly, steadily, and deeply. Do not rush step 2 and 3. It is important to breathe in slowly through your mouth just before pressing the canister. Step 4. Remove the inhaler from your mouth. Hold your breath for 10 seconds, or for as long as is comfortable. Breathe out slowly, preferably through your nose. If another dose is required, wait for at least 30 seconds to 1 minute and repeat steps 1 to 4. After use, replace the mouthpiece cover. When using an inhaler, rinse your mouth with water after use, as this will prevent you from developing an oral fungal infection.